All right, good afternoon, everyone. So, wellness, well-being, whatever you want to call it. For us, when we talk with our clients, we're increasingly using this phrase of human capital, which I'm not going to use a lot for the next half an hour or so, because it's fairly emotionless. But I think it's kind of the right time to mention human capital. I think when we talk about human capital, what we're talking about is how well-being is the key to unlock the door to maximise the potential from your human capital. You hear a lot of employers talk about their employees being their greatest asset. A couple of quotes on the screen. If you Google it, you will get hundreds and hundreds and hundreds of business leaders saying their employees are their greatest asset. And if that's the case, and if employees are an employer's greatest asset, then surely, like any asset, that asset requires ongoing management. It requires investment to maximise the growth from that particular asset. I'm going to stop talking about employees and human beings as assets, but you get the point nonetheless. So as I said, well-being for us isn't, and I'm sure everyone in this room agrees, well-being isn't this fluffy thing anymore. It isn't a tick box exercise because you've been instructed by someone in the States that you need to implement a well-being strategy, or it certainly shouldn't be anyway. Well-being is something that can improve business performance significantly, and I'll come on to how I think that happens and how to track that. But yeah, for me, well-being is the key to unlock the door to maximise your human capital and the performance from that. So we conducted a survey back in the end of last year, so our Workplace Wellbeing Index. So back of the room, Barnett Waddingham stand. If you want a copy of that, come and have a chat to us, and we'll give you a free copy. So just some stats on that to share with you. 94% of employers think wellbeing is important, so that's good. I think if we'd have asked that question 10, 15 years ago, there'd have been more scepticism around wellbeing. So it's good that a lot of companies recognise the importance of it, but only a third have a wellbeing strategy in place. Or just under a third actually, which I think resonated or was similar to the stats that Phil sort of talked about at some of his opening remarks. So, we're sort of seeing a similar thing. 31% of employers see the ageing workforce as their biggest challenge. I think that's probably unsurprising. We've heard a few people talk about that. And 72% of employers offer flexible working to their employees, while 70% offer PMI. And it's interesting that some of the things that perhaps wouldn't have been talked about as well-being benefits 10, 15 years ago are now camped in that well-being arena. So things like private medical insurance, flexible working, I think historically well-being might have just been, like we've heard it a few times, fruit in the office, gym memberships, a bit of resilience training, and a massage every other Friday. Well-being, but it's not that. We all know that now. It's not. It's so much more than that. So I've got a quick question, if this Slido thing works. Technology normally hates me, so it probably won't work. Just a quick question for you all. Do you have a wellbeing strategy? Yes, but it needs updating. No, but we are looking into it. And no, and we have no intention of doing so. Okay, so similar to sort of results from our survey, really. Probably a third there that have it, and 2/3 that are looking into it or so. So again, I think most companies, again backed up by this, most companies are looking into it if they're not doing something now. And I'll come on to, for those of you in the room that are doing nothing, then hopefully I can convince you by the end of the next sort of 20 minutes or so that wellbeing is something you really should look at and invest in. So we've heard a few people talk about creating a framework around wellbeing. Fundamental for me. You have to create something tangible around wellbeing. I think historically wellbeing has only been referred to in connection with health, which is why you see a lot of wellbeing initiatives are based around people's health. So it is gym memberships, it's walking clubs, it's running, it's triathlons, it's health related stuff. Health is really, really important, don't get me wrong, but for me it's not the only thing that impacts on someone's well-being. So we have some pillars as well. We have 6 pillars. It's not a small man syndrome thing. We've got 6 pillars: job security, financial security, health, support, protection, and work-life balance. We believe they're the 6 areas that combined contribute towards an employee's or workforce's total well-being. The example I always give is that you could have the physical prowess of an athlete, but if you're struggling with problem debt, or you're working from 6 in the morning till 8 o'clock every night because of workloads, you're not going to be as productive, you're going to be potentially taking more absence, and it's going to impact on your performance as an employee of your employer. So we need to stop thinking about well-being as just a health-related issue. It's not, it's so much wider than that, and that's why we've created this framework of the 6 pillars. So we actually went out to employees and asked employees a series of questions around those 6 pillars. So no specific industry sector. It was across all different sectors, different ages, different affluence levels. And we went out and asked a few questions around each of those pillars. I'm not going to go through all of this, you'll be pleased to know. But again, there's another survey out there on the back wall with our stand. It's the Why Be Well survey, it's called. Feel free to pick up a copy of that. But I just wanted to give you some thoughts around what we're considering around each of those pillars and what they actually mean to us. So job security for us, is your job security a concern, and have you considered leaving over your job security? Are your line managers adequately trained? Are employers kept up to date with company performance, both operational and financial? So 14.9% had considered leaving over their job security, so that's 14.9% of respondees to our survey. If that was my business, 14.9% of people saying they've considered leaving over their job security would be a concerning number for me. I would class it as a significant minority. So there are issues there. Financial security, is immediate financial security a concern? Is future financial security a concern? 15.5% said their immediate financial security was a concern. Unsurprisingly, perhaps 32.7% said their future financial security was a concern. It's an age thing, depending on whether it's immediate or future. So we did notice that. So 40.8% of those aged over 50 had future financial concerns, compared to only 17.6% of those aged 18 to 29. So age was a differentiator. In terms of health, is your job detrimental to your health? Is your employer supportive in helping you lead a healthy lifestyle? Some stats there. Protection, do you have adequate protection for maternity and paternity? Do you have adequate protection in the event of absence, long-term disability and death? Interestingly, most people thought they didn't have adequate protection. I'm pretty sure that most of them do have adequate protection, they just don't realise it. They're not told about it, benefits aren't communicated well. It happens quite a lot. In terms of support, is your direct manager approachable and supportive? Does your company care about you? 23% felt as though the employer just simply didn't care about them. And work-life balance. Do you have a good work-life balance? Does your employer help or hinder that work-life balance? I think work-life balance is an interesting one. Apparently we're top of the EU charts as a country for working hours, but we're bottom for productivity. So we work really long hours but don't do very much, which sounds about right if you look at some of my team. But no, in all seriousness though, it's a cultural thing, I think, for this country. You look at some of the Scandinavian countries and, they work shorter working hours and they're really, really productive. And I think it's probably because they're working at almost 100% capacity for 6 hours, whereas we're maybe working at 40, 50, 60% capacity for 7, 8, 9 hours a day. That's a cultural shift. That's not something that we can fix in this room today. Probably not something we can fix in the next decade or so. But something that is worth thinking about, I think. So, quick question again. What do you think, out of the 6 pillars of well-being, of our 6 pillars of well-being, do you think is the biggest issue in your workforce? Which one of those would you say would be the biggest issue for you, for your employees? Yeah, I think financial security is creeping up the agenda, isn't it? I think 10 years ago, if I'd have put that question up, financial security would have been near the bottom. Work-life balance has always been an issue, hasn't it? There's so much press coverage around work-life balance, around, are we putting too much pressure on our employees? Do we give them workloads too much? There's a lot of focus around that. Excellent. Okay, so the wellbeing model. What is the wellbeing model? For me, there's 4 stages to building a wellbeing strategy. Analyse, build, engage, govern. My boss likes an alternative. He uses ACDC. Analyse, check, Analyse, consult, deliver, check. I like analyse, build, engage, govern. Analysis, so survey your employees, similar to the survey I was just showing you there. Do something similar for your employees. We do a lot of work with our clients in surveying their employees, asking them questions around the framework of the 6 pillars. And I think asking, you heard it earlier, asking your employees is so important. Don't presume to know what's wrong with them. If you've got a small company, you might know because you're so close and you all work in the same office, and that's fine. But if you work for a medium to large size organisation, you can never possibly know what the problems are that your employees are facing. So ask them. I'll come on to it in a moment, but it's this notion of paternalism. Is paternal? A lot of companies or professionals want to say that their company is paternalistic. They want to be paternalistic. Paternalistic to me is adult-child relationship. It's hand-holding. It's I know what's best for you. Here it is. Well, surely being in an inclusive relationship where you actually ask your employees, what are your issues? If it's an issue that's affecting not just you, but you and you and you and you and you and a large proportion of the workforce, then it's probably something that's worth addressing. So we're really keen on surveying employees and asking them the questions. Use your data, so absence data, claims data from things like medical insurance. If you want to create a return on investment forecast, what we tend to do with our clients is actually forecast where we think premiums are going to be for certain product and absence is going to be in 5 years' time. So if you want buy-in from finance directors or CEOs, try and forecast where you think and again, like I say, we do quite a lot of this work. Absence is now costing £1 million. In 5 years, we predict it's going to be £3 million. That might make your finance director or CEO stand up and think, do you know what? I haven't budgeted for that. That's not in my... I know absence is a difficult one because no one physically writes a cheque for absence, but it is still a cost out of a business. Certainly things like medical insurance, life insurance, income protection, product, they're costs out of the business. So try and forecast and predict this is where we're going to be, like I say, in 5 years' time. In terms of build, so prevention and intervention, absolutely. We've heard that a few times today. And have a strategy, have a brand, create a brand around it. You can't build, in my opinion, you can't build a strategy unless you've done the analysis first. Otherwise, you might as well be punching blind. Some throwing dartboards at a dartboard, throwing darts at a dartboard with a blindfold on. Some will stick. But most won't, or most won't hit the target. Take the blindfold off, do some analytics at the front end, understand your workforce, ask them their opinions, and then build a strategy. That's the only way to really do it and really get a true return on investment. And I think the return on investment bit for me, I know we've heard a few things about return on investment. For me, there has to be a return on investment. And I would class attraction and retention of staff, better engagement, lower insurance premiums, lower absence rates, it's all a return on investment to me. There has to be a return on investment from Wellbeing. Every single product that you offer has to provide some kind of return on investment, otherwise what's the point in doing it? If it doesn't provide a return on investment, don't do it, take it away. If there's no return on investment, it's not benefiting your business in any way, then don't do it. Engagement, big part of this, and I think where some people really struggle, they spend a lot of time building a wonderful strategy, but they fail to connect it to their employees. They fail to facilitate that connection between the employee and the strategy itself. There's partly line manager training needs there, I think. So line managers, back in the day, they weren't just back in the day, they were probably just the approvers of holiday and some supervisors of work. Now they're expected to be mentors and counsellors and spot the first signs of stress in the workforce, and they're chronically undertrained to do any of that. But yeah, coming back to engagement, communicate, educate, use technology as well. People don't want to have people like me standing in front of them talking about dental insurance and resilience anymore. They want to do it on their phones. They want to do it in a technological environment. Certainly a lot of the workforce does anyway. So we use technology quite heavily. And then governance. So governance has long been associated with pension schemes, but use governance for wellbeing as well. Monitor what you've done, track the return on investment, and evolve the strategy if trends change. If you pick up on differences in what your employees are telling you, you're picking up trends or differences in trends around absence, then tweak the strategy. It's got to be ever evolving. So in terms of analysis, like I say, use the 6 pillars and work out what you think the problem areas is within your workforce. But don't just think about the workforce at a high level. Think about the workforce in different demographics as well. So it could be that legal and HR have really high well-being, but finance and customer service have really low well-being. It could be though that customer service is actually a transient workforce for us, so we don't really care. That's fine. If that's your business model, who am I to say otherwise? But actually looking at different demographics, looking at departments, looking at geographical locations, looking at age, looking at affluence. Wellbeing doesn't have to be a blanket approach. It can be targeted to specific areas of risk. So if you identify an area of risk, you can use wellbeing to target that specific area without having to roll out some company-wide initiative. So do use demographics, or break down into different demographics. So in terms of analysis, big data equals targeted spend equals big ROI. That's pretty obvious to us, and hopefully that resonates. In terms of build, this is not an exhaustive list by any stretch of the imagination. I've just thrown some ideas down there with stuff we've done with some of our clients. As I said, line manager training, really important, I think. But the build stage, that should look different for every single company, because the well-being is unique to all of us. So therefore, well-being is unique to every company. And if every company's well-being position is unique, the strategy they have to combat well-being should be unique as well. But I guarantee that most people in this room have broadly similar products and benefits that they offer their employees. And I think that's a sort of a sign that we're not quite where we need to be in terms of tailoring well-being specific to our organisation and the risks that sit within it. I still think there's a way to go. Engagement, as I said, really important to connect it with the employee. I mentioned this earlier. Three, I'm not going to say pillars, three approaches to engagement for me: disinterest, not caring; limited contact, disillusioned employees; paternalism, which I think a lot of people think is the holy grail. I disagree. Paternalism's hand-holding, assumes what's best, possible employee resentment if you get it wrong. Inclusive is inquires, understands, cares, and actually involves the employee. If you engage the employee is much more likely to engage with you back. So, quick question again. I don't know how I'm doing on time, but what sort of employer are you? Inclusive, paternalistic, or disinterested? If anyone says disinterested, I want them to put their hand up. Wow. Okay, I wasn't expecting that. Okay. Yeah. Okay. So I think you're right. I think a lot of companies position themselves as paternalistic, and I kind of feel like I'm beating paternalism down, and I'm not. Paternalism's a great thing. You care. That's a great place to be. You actually care about your employees. I just think sometimes paternalism, like I say, can be seen as hand-holding. So facilitating the strategy to the employee. Technology for me is the way to do that. Like I say, people bank on their phones these days. They do everything on their phones and their tablets. They kind of want to sort of interact with their employers on a sort of well-being strategic level through technology as well. So we've spent quite a lot of time building out our Me Too solution. I was going to show you a video here, but I wanted to save a bit of time. So if you want to see the video, which is some of the stuff again we're doing with our clients, then come to the back and see me after. And governance. So again, do the analysis, survey your employees on a regular basis. Don't just do it once and then never do it again. Ask them on an annual basis the same questions so you can track the responses, track changes so that you can adjust the strategy where needed. But also you can track ROI as well. So tracking the return on investment, you can do that. And the return on investment comes from a number of areas. So again, there's 6 of these. We like the number 6. Reduced accidents at work, increased productivity, reduced absence, higher attraction and retention of staff, lower insurance premiums and better engagement. There are probably a couple of others that you could name. We just focus on those 6. And some of them are easy to track. Assuming you record it, absence is easy to track, whether there's an improvement in absence. Productivity, more difficult to track. Significantly difficult to track for some. Reduced accidents at work, fairly easy to track. Better engagement, surveys, fairly easy to track. Lower insurance premiums, very easy to track. Attraction and retention of staff, again, very easy to track. So you can track return on investment. And I think we need to. We have to evidence that we're doing something for the greater good of the company and our employees. So let's evidence what that is. Talking of evidencing success, lots of studies out there. If you suffer from insomnia, have a look at some of these reports. They're 200 pages long, some of them. The PwC research is particularly good. I'm not being sarcastic when I say it is actually really good. And the McLeod report as well from 2009 is very good as well. So there's lots of resource out there for you to have a read. And you know, you've heard some companies today talk about their excellent work in the world of well-being. You know, there's other stuff out there, you know, as well. So have a read of it. I think I've got time for some questions.
Right, well, thank you for that, Carl. We've got a few questions, so we'll pick out the most popular one. If work-life balance is our biggest concern, why is this such a small part of most wellness strategies?
You tell me. I don't know. Why? Maybe because it's the most difficult one to fix. You're talking about significant cultural shifts well, you're talking about massive shifts in the way that a business operates if you start messing around with work-life balance. I mean, you've seen it a lot recently with flexible working. There's now, correct me if I'm wrong, but there's now compulsion on employers to actually look into flexible working when there's a request to do so, isn't there? You don't have to do anything, but you have to at least look at it and then say no. But, you know, sort of home working, you know, it's becoming more and more popular. So I think, you know, obviously it's moving in the right direction, work-life balance, but are we going to become the Scandinavians overnight? No. Do we want to be? Probably not. But we need to do something and move more towards that direction, I think.
Okay, and then the next one, how does Barnett forecast 5 years on? What data do Barnett have available to benchmark with?
Yeah, so we employ 120 actuaries. Which is an interesting, yeah, I don't know if any of you in the room are actuaries. I'll try not to offend anyone. We all know what actuaries are like. They're very, very good at spreadsheets and forecasting, and they're very, very, very clever mathematicians. And, you know, we've got a lot of sort of mortality, morbidity data which we use. We've got a lot of absence data that we use. And, you know, we've got, I wish I could explain it to you, but we have actuarial expertise in doing our forecasting. So I'm confident, very confident, that what we do is relatively accurate. And what I've seen, you know, we've got evidence of that from forecasts we did a couple of years ago that are coming to fruition now.
Okay, I think we've got time for one more question. So how do you engage the younger population to participate in the financial wellness programmes? Particularly interested in this one as well.
I think make sure you get your messaging right. So talking to young people about pension investment strategies is not the right engagement strategy for young people. For me, pensions, you know, I'll focus on pensions and then move on to the other stuff, but pensions for me, talking to someone who's 21, the message is just stay in the bloody thing. Don't come out of it. That's the only message you need to give to a 21-year-old, probably up to the age of about 30 or 35, just stay in it. After that, you can talk more about investment strategies, and when you get to a certain age, you can talk about exit strategies. But when it comes to young people, you know, they are coming out of university with huge debts. They might have lifestyle debts that they've accumulated as well. So engaging with them at that level and actually trying to help them and find solutions is I think, the way the world's moving. You'll see the stuff that Neighbour are doing, and you'll hear from them later. You know, it's really exciting stuff, and I'm sure that market is going to evolve massively over the next decade or so. But I think, you know, you have to kind of help them if you're willing to ask them what their problems are. You kind of have to be willing to help them a little bit if you think it's a problem that you can help them with. I think, like, everyone talks about education with financial services or financial concerns, but if you're already in debt, education doesn't really help. You know, I'm in debt. Okay, yeah, you're in debt. Yeah, I know I'm in debt. You need to help me get out of debt. Oh, we can't do that. We're just going to educate you on what debt is, or we'll tell you how not to get in debt in the first place. Well, I'm already in debt, so that's not very helpful either. So find out what the problem is, and like I say, you know, there are plenty of solutions out there now. You know, you just need to marry up the right solution with the problem that you identify in the first place. And that's the key, you know, identify the problem, find a solution.
Okay, thank you very much, Carl. Thank you.